So I'm just going to jump right into this. I've got a lot of slides, and we've got 1 hour. And if you're interested in Q&A, feel free to join me in the back on the table, and I can help answer any questions you may have. Nutritional Solutions for a Pharmaceutical World. Originally, it was titled Nutritional Therapy for a Pharmaceutical World, but my legal counsel said to change it to Solutions instead. And we're just going to jump into the disclaimer. Make sure all of you read this. Speed readers. Good. All right, so the bottom line is I wake up every day with this vision where everyone, basically all men, women can live in a world and have the right to be healthy and unmedicated. Just have that as an option. How many of you have children? Raise your hand. Okay, so this is not only a vision for me, my clients, you, but also our children and our community and the future generations that are to come afterwards. So as my background mentioned, I studied at Berkeley, molecular cell biology and psychology. I was pre-med, and I did take a Nutrition 101 class, and guess what they taught me? A vitamin C deficiency leads to scurvy. A vitamin D deficiency leads to rickets. B1 deficiency, that's not what I wanted. I wanted to learn how to use foods to heal and support and nourish the human body. So I did graduate, and I became a pharmaceutical sales rep. And I worked for the dark side. And so one thing is that most people, they hear my talk and they ask me, Gerald, at which moment in time did you realize that you didn't want to be a pharmaceutical sales rep and you wanted to get into whole food nutrition? And the story went like this. How many of you actually know how pharmaceutical sales reps conduct their business? Any of you? Okay, so half the room. Some of you don't, and I'll explain a little bit of what I did. I had an American Express corporate credit card, no limit, right? And I would, on average, spend $5,000 a month on food. Who does that? My mortgage is not even close to that. One month I hit $10,000. And I always went back to my manager and I asked, what's the budget? What is my limitation? She said, spend until I tell you to stop. I was never told to stop. And one evening at a winery, I was taking out a medical doctor, a client of mine, and his spouse. And we had 2 hours of witty banter, and of course then comes the bill. And in the bill, it's after tax and tip is about $600. And I was trained to close as a sales rep, always close, ABC, always be closing, right? And when the bill would come, that was my turn to go to work. And the medical doctor's wife went to the restroom, and I simply sat down and I said, hey, doc, I'm trying to win this contest, and it ends in 2 weeks. Can you give me 10 more prescriptions? And he looked at me and said, anything you need. Now, of course, as a trained sales rep for the pharmaceutical industry, I thought, hey, you know what? I did my job. I improved sales. I grew revenues. But on that night, I drove home, and I thought to myself, you know what? I entered the pharmaceutical industry to help people, and I'm actually doing the opposite. And it became evident that I was a business person. And perhaps there are people out there being prescribed medications that they don't ever need, and that was because of me. So in those 5 years, I developed a lot of karma. And the reasons why I give this lecture is so you can help me undo that karma. Okay? So I left the industry. I got trained as a nutritionist. Or actually, I left the industry and I went to Asia. And I did my MBA, and I worked with this Taiwanese herbal company called Sun10. A lot of the acupuncturists use their products. And they hired me to conduct a market research analysis on how to launch one of their herbal formulas into the US. And the one thing that I learned about them is that that formula was currently being prescribed by medical doctors in Taiwan to patients. And just totally blew my mind. My paradigm of healthcare shifted. But of course, while there was for 2 years, I was getting into Qigong, acupuncture, Tui Na, detox. I went on a 5-day silent meditation retreat. I mean, it was pretty cool. And so my whole life transformed in those 2 years. And when I came back to the U.S., I became a certified nutritional consultant, started my own practice called The Healing Body, and I got back into nutrition. And what's ironic is my very first nutritional client came to me taking 2 of the medications I formerly promoted, right? Talk about karma kicking you in the butt. Of course, my patient management, my client management skills weren't up to par. They weren't developed. So that person eventually left me. And that's one of the reasons why I wrote the book. It's one of the reasons why I lecture. It's because I hope that that person still makes it one day to either one of your offices so they still have that chance to becoming healthy and unmedicated. Here's an interesting article. It was published in 2003. New York Times Magazine. It says on the title, on the front cover, half of what doctors know is wrong. And this was when I was a drug rep. So, I wonder what could this be? What do they mean half of what doctors know is wrong? Well, it's written by a medical doctor named Lisa Sanders. And I'll just read the first paragraph verbatim. It says, a decade ago, I stood alongside my 99 fellow freshmen as we were welcomed into the ranks of medicine in a white coat ceremony. Here on our first day of med school, we were presented with the short white coats that proclaimed us part of the mystery and discipline of medicine. During that ceremony, the dean said something that was repeated throughout my education. Half of what we teach you here is wrong, and unfortunately, we don't know which half. Okay? Raise your hands if you believe that real health solutions should be more certain than a coin flip. Absolutely, right? Okay. Here's a MedWatch article. If you see, it's actually printed in 1995. And the title is Clinical Therapeutics and the Recognition of Drug-Induced Diseases, also known as iatrogenesis. It's not talked about. In fact, when I was a drug rep, we didn't even know what iatrogenesis was. That's not vocabulary they would want us to intentionally know. I'd like to blow this portion up. It says, when a drug goes to market, we know everything about its safety wrong. They know they don't know, right? And we know that these medications can have all kinds of effects, which they put in the title of side effects, but they have all these effects. Here are the number of adverse reactions reported each year. Right? So in 2013, over 1 million were reported. However, when you look at the stats down below, you can see the references. Only 1% of drug side effects are reported to the FDA in the US. So we know that perhaps there's, 100-fold side effects being experienced by your clients, by the American public. How many of you remember Vioxx, that whole debacle, right? Okay, Vioxx in 2004, whoever wasn't informed about it, is a drug that was known to lead to increased cardiac events, heart attacks, strokes, and even deaths. So it got taken off the market, and this was in 2004. However, then you have the lawyers come in, right, to try to find who's still alive and try to help them, technically, right? But is this the solution to a drug recall where now you have a lawsuit? I mean, does that person who has a lawsuit built by the lawyer still achieve optimal wellness? That's where you come in. Here's a whole list of medications withdrawn after the Vioxx debacle. So while Vioxx was not the first medication to be recalled off the market, it also wasn't the last. In fact, there are codes for drug-induced deaths. And we all know the ICD-9, ICD-10 codes. They have to be entered into reimbursement forms so that a practitioner can be reimbursed for whatever services they provide, and that includes drug-induced deaths. What is that? Drug-induced diseases, okay? So here you go, drug-induced causes. So it makes me wonder, if there's a new drug out there and a patient is being prescribed this drug, would they prefer to be taking that drug, or would they prefer to be testing bulletproof vests, okay, as a living? Which is it? Can you imagine what this guy's thinking? Is he thinking, I hope this bulletproof vest works? Is that what he's thinking? Or is he thinking maybe, don't shoot me in the face, right? All right, so medicine versus a poison. A medicine, by definition, is an agent used as a remedy to treat injury or cure a disease. A poison is a substance that causes injury, illness, or death, especially by chemical means. Is it possible to convince a person that a poison can be a medicine? So we can talk about warfarin. Warfarin is actually, if you looked at historically, it came from fermented hay, the spoiled sweet clover hay. And what happened was these cows were actually consuming the clay and were exhibiting hemorrhaging. They were dying because they were having hemorrhaging occur. Scientists, right, what do? They go find the active constituent, make a synthetic version, patent it, and then start to make a profit, okay? The use of warfarin itself as a rat poison is now declining because many rat populations have developed resistance to it, and because of considerable greater potency, poisons of considerably greater potency are now available. So now warfarin is becoming an ineffective poison for rats, but perhaps these manufacturers have all these reserves. What are you going to do? Remarket it as something else. And now warfarin is the most widely prescribed oral anticoagulant drug in North America. All right? Wait a second. I thought it was originally a hemorrhaging agent, and you're giving this to prevent stroke? Interesting. So one person's rat poison is another person's medicine. Okay, chemotherapy. The first patient in the U.S. was treated in December of 1942, as discussed in a historical account of nitrogen mustard as the origin of chemotherapy. Okay? Nitrogen mustard, as we all know, is a biological weapon. Okay? Yet, they're injecting this into people. I had a stint. Mustard agents here, I'll just mention this, are usually classified as blistering agents owing to the similarity of the wounds caused by these substances, resembling burns and blisters. However, since mustard agents also cause severe damage to the eyes, respiratory system, and internal organs, they should preferably be described as blistering and tissue-injuring agents. My clients who come in and they're on chemotherapy, I always find that they need lots of epithelial repairing type foods, okay? Epithelial foods, skin epithelial, right? Dermal tissues. When I was, I had a stint visiting oncology pharmacies, and these pharmacies would have these hoods in which not the pharmacist would be preparing the chemotherapy, but the pharmacy technicians who attend a trade school. And each of these pharmacy technicians had to sign a waiver saying they were not going to get pregnant or were pregnant because not only is this nitrogen mustard dangerous, but it can also cause birth defects. Okay? So one person's biochemical weapon is another's medicine. The International Agency for Research on Cancer, what they do is they analyze chemical substances, chemicals. So if they're doing research on the causes of cancer and all they're looking at chemicals, it tells me, I think I have an idea what could be some of the causes of cancer, right? And so what they do is they rank these chemical agents and they put them in different groups. Group 1 is a known carcinogen to humans, and then they go down to probably, possibly, unclassifiable, and probably not carcinogenic to humans. If you go on their website and you look at cyclophosphamide, also known as Cytoxan, for you who have seen breast cancer clients come in, they're usually given AC chemotherapy, AC, the A being adriamycin, the C being Cytoxan or cyclophosphamide. Well, it's a group 1 chemical, and the evidence for carcinogenicity to humans is sufficient. And they give this to people who have cancer. So one person's cause of cancer is another's cancer therapy. So we live in a confusing time, right? Many of you know butter, margarine, that whole tug of war, but many people don't know about this. And, and when I found out this information, I was like, wait a second. I've heard Hippocrates say something along the lines of letting food be your medicine, but where is that? And so I looked at all the translations of the Hippocratic Oath, and it was revised in 1964. Through 1964, it had, I will apply dietetic measures for the benefit of the sick. I will use food as medicine according to my ability and judgment. I will keep them from harm and injustice. I will neither give a deadly drug or to anybody if asked for it, nor will I make a suggestion to this effect. but rat poison? Wait, but nitrogen mustard? And so they removed this in 1964. Right? It's the day I found out was kind of like this kid. Right? When he found out Santa Claus was no longer present. Okay? A very sad day. A very sad day. All right, so we know the whole food nutrition pioneers. We've got Weston A. Price, his phenomenal work in nutrition and physical degeneration, where he studied what did those healthy societies eat, right? Organ meats, vegetables, fermented, raw, cooked, and also herbs. The one thing that's not so much documented in this book is that each of these tribes had locally wild-crafted herbs available to them. We know the work of Dr. Francis Pottinger Jr. about his cats, the first epigenetic study looking at the influence of food across multiple generations. And the most important part of his work was that when he took that infertile group of cats and he fed them the foods they should normally eat, raw milk, raw organ meats, cod liver oil, you can restore health over 4 generations to the point where that litter was just as healthy as the starting population. So he proved to us the influence of food, multi-generational. And then we have D.C. Jarvis, obviously very popular for his book, Folk Medicine, talking about raw honey, apple cider vinegar. Melvin Page for his work on the phase 1, phase 2 diets, very similar to what we see in the Gerson therapy. And then Royal Lee, who took a lot of the foods that Weston A. Price studied and found out those societies within that had exhibited perfect health. And he took those foods and he put them into food formulas. So there's a lot of vegetables, organs, herbs. And together, we can see that by example, too, when we lead our clients. This is my refrigerator. You can see on the left here is my green smoothie. I've got some water keefers, and that's a cow kidney. And on the right-hand side is my son's baby food. This was, probably about half a year ago. It's pretty paleo. There's butter. There's some sweet potato, some beef, some fish roe, broccoli, lots of good stuff. This is top shelf nutrition right here. Yeah. The first day I found the local butcher who actually had organs from pasture-raised animals, I went crazy. I started getting the beef heart, I got spleen, I got pancreas, I got kidneys. And then my wife comes home from work one day and she opens up the fridge and she closes it, she looks at me and she goes, "Whose body is this?" Right? So, very important though, getting back to nature. Now, this is what I see as a recipe for sicker society. In today's world, most people develop a chronic illness that's developed from chronic malnutrition, okay? And we can also even add chemical toxicity from the environment. So what happens is typically people will then go and see their medical doctor, and the medical doctor goes and prescribes them a drug, supposedly designed to treat that disease. But we also know that if someone's on a pharmaceutical, their body becomes even further malnourished. And there's thousands of clinical studies in this book. You can even go to pubmed.gov and find studies. Now, keep in mind, these studies only document the known nutrients. The known nutrients. There's so many unknown nutrients in foods that can't be studied or detected, right? It's kind of funny, those societies that Weston A. Price studied, none of them knew what a vitamin was. They just knew what foods to eat. And so naturally, when someone has an illness caused by malnutrition and then they get put on a pharmaceutical, which exacerbates the state of malnutrition, then what do you expect next? Drug-induced diseases. Okay. The first edition of Drug-Induced Diseases was published in 1962. Unfortunately, this is the trend. People are going down this path. And instead, we've got to take them back here. And that's what our job is, to take them in this direction, right? Feed them the foods they've always needed. Over 61% of the adult population in the U.S. is on a prescription drug. If you're not on a drug, you're below average, right? You're the minority, okay? But this means is there's a lot of people out there who need your help, a lot. Dr. Royley said that one of the biggest tragedies of human civilization is the precedence of chemical therapy over nutrition. It's a substitution of artificial therapy over natural, the poisons over food, in which we are feeding people poisons trying to correct the reactions of starvation. You know how ridiculous this is, and you know how widely it's being done. He said this in 1951. Okay? So what I'm recommending for all of you today is to have on your intake forms, many of you already do, and for those who don't, ask these questions. A history of all the current medications that they're currently taking and those they've taken in the past. I see too many people who have had birth control pill use for 5, 10 years, then stop, get pregnant, and then maybe have maybe some issues of estrogen dominance, right? Fibroid developing, endometrial cancer, perhaps polycystic ovary syndrome. We want that information, even though they think that just because they stop the drug means that it doesn't still affect them today. And it's important we ask this information. Also, very important is you ask what supplements they've taken in the past. So I primarily focus with food formulas, and oftentimes I've seen some people on a high-dose synthetic from another practitioner then have challenges weaning off because withdrawal syndrome can occur with any chemical taken in high dose for a chronic period of time. So it's important that I also have this information. And when we have this information, and we've got a problem, we don't sit around and take photos, right? Okay, so my brother's a firefighter. He says it's natural with every class, every academy, that they light the house of fire that was going to be torn down anyway, and just for remembering their training, they take this photo. So they're not there on site letting a house burn, okay? It's a training protocol that they have. So in order to understand pharmaceuticals, there's a couple of resources. You can obviously buy a physician desk reference, and I do not recommend this because it's updated annually, and eventually, after a couple of years, you're going to run out of shelf space, right? So instead, I recommend that you log in and have an account with Hippocrates. You can even install the app on your phone, and you can have access to the same information every medical doctor has access to. In fact, when I did preceptorships as a pharmaceutical sales rep, MDs would forget what drugs they had to prescribe for what condition, and they would go and refer to Hippocrates and look it up. In the words of my friend who's an MD, he says, that software, that app saved my life. Okay? So definitely download it, open an account. I'm going to show you how to use this resource. And also, make sure PubMed.gov is your friend. Get to understand how to look for clinical studies supporting what you suspect the drugs are doing within your clients. And I'll show you some examples how to navigate through it. So let's look at Hippocrates.com a little bit more closely. Right? All you do is you have your account, you log in, and you simply then get this nice screen. You can type in the drug on drug lookup, and it'll tell you all the branded versions of it as well as the generic versions of it. So let's take, for example, now you see here this monograph. I'm going to blow this up. The monograph, there are 2 tabs you should just stay focused on. You can look at all the other tabs, but primarily the 2 tabs you want to be focused on are the adverse reactions as well as the pharmacology. This will provide you so much information as to what these medications are doing to your clients, right? So if we look at Lipitor, you have any clients on Lipitor? Any at all? Okay, it's one of the most top prescribed medications. Okay, so under pharmacology, you can look under mechanism of action. And so we know that statins inhibit the liver's ability from producing cholesterol, right? So you can look at that and you can know which organs is this drug hampering? Which one is it injuring? Which one is it forcing it, mandating to do something that the MD wants it to do? And what we have to do is remember the purpose of cholesterol. Cholesterol is produced in the liver and then transported by low-density lipoproteins to the adrenals, to the gonads, so that we can produce the steroid hormones as we need. So here's a little tip. If you have a patient on a statin chronically, and all of a sudden the medical doctor says, we're going to need to put you on a testosterone cream, I wonder what was the cause, right? And the industry wants the patient to be on the first drug, and then the second, and then the third, and then the fourth, and the fifth. It's a growth industry. There's investors, right? There's stock options to be paid, okay? But we have to bring clarity because this is kind of madness to take one drug to inhibit the liver from doing what it wants to do and then to give a testosterone cream or a testosterone supplement to address the side effect of the first drug. I mean, that to me just doesn't work in my practice, okay? Especially if we are wellness practitioners. This is what we have to address. There are some practitioners, maybe we start off as, I will get you better, okay? Because I can help you overcome the side effects of drugs. But that's not for me, and I know that's not for you. We are wellness practitioners. So I also run saliva tests. I do all kinds of diagnostic tools. If you look at diagnostics, they take the pituitary hormones as well as, here you have the androgens. So this is someone who ends up getting on testosterone cream. Testosterone's elevated, DHT's elevated, androstenedione is elevated, the estrogens are elevated. I mean, this person is overdosed, okay? And of course, they come to me, and we have to fix this, right? So the solution is not to keep them on the statin drug and then the testosterone cream for the rest of life. The solution is to correct the hormone imbalances. And then look at this. Luteinizing hormone is elevated. The pituitary hormone, LH, that tells the testicles, hey, you need to make more testosterone. The pituitary is confused. It thinks there's not enough testosterone. This is the reason why I also measure pituitary hormones to see if there's any pituitary imbalances. In this patient, there's too much testosterone, and the pituitary thinks there's not enough. In this case, this is testosterone hormone resistance, right? We hear about insulin resistance, cortisol resistance. This is testosterone resistance at the pituitary. Very important. It's kind of madness, right? But this person was on a cream for a while. Let's take another example, methotrexate, given to a lot of clients and patients who have immune disorders, right? Autoimmune conditions. If we look at the mechanism of action, it's an immunosuppressant, and it inhibits dehydrofolate reductase. So it's working as a folate antagonist, We're all studying about genetic SNPs and MTHFR, and here you have a drug inhibiting the body from using folate, right? It's like, wow, this is interesting. But it's also an immunosuppressant. So this person who's taking an immunosuppressant drug needs to be eating foods to keep the immune system strong, right? So the 4 organs that produce white blood cells, bone marrow, spleen, thymus, liver, they need to be eating this every day while they're on that drug, because otherwise the drug is going to be creating problems to any one of those organs. And we can see from the list of side effects, so the other tab that you want to focus on, not only pharmacology, but also adverse reactions, are these listed. And I'll read some of them because it's a little bit small in the back. You might not be able to read it. But you have thrombocytopenia, right? So it's having an impact on the blood, the bone marrow. Leukopenia, anemia, hepatotoxicity, cirrhosis, hepatic fibrosis. So it's having problems, it's creating problems already to the organs of the immune system, those 4 organs responsible for building white blood cells. Now, the thing is that those 4 organs build white blood cells. You just remove the thymus, and now you have the organs that build red blood cells. That's why you also see anemia on there. So it's important to understand the mechanism of action, and then put 2 and 2 together and understand why these side effects are possible. However, if you look on here, there's also nephrotoxicity. Wow, so it's damaging the kidneys potentially. Pneumonitis, right? So the lungs. Seizures, encephalopathy, so perhaps the brain. And look at the list of side effects, right? Lots of things to address, okay? So it's very important that you understand how to use Hippocrates to look up pharmacology as well as side effects. And then what you do is you take your findings from Hippocrates and you put it side by side your current intake form. I use the system survey form. You can use the NutriQ. And you find out which symptoms correlate to what's listed as a side effect, and you turn on some light bulbs. Okay? Now, you do not do this on the first visit, right? I lost some clients because here they are in the intake, and I'm looking, I'm like, do you see what I see? And all this time they're thinking, I really like my doctor. Are you calling my doctor an idiot? Right? Remember, first rule into building a practice, do not call somebody's baby ugly. Okay? You don't build friends that way. And the same thing, you don't call a patient's doctor, insufficient, let's say. All right, so we look at Hippocrates a little bit more. On the pharmacology tab, you're also going to see if the drug is excreted via the bile. So we know that means that there's extra work for the liver, work that the liver never had to do. I mean, if you look at the traditional natives, there's mainly a couple reasons what the liver would always do. Number one, produce bile so they could digest fats. They didn't have toxins. They didn't have off-gassing. They didn't have cars, right? That was the number one reason. Number two is maintain blood sugar. But if you got a high-fat, protein, low-carb diet, you've got balanced blood sugar. So right now, we live in a society where the liver is overworked. If you look on the pharmacology tab and you see that the drug is excreted via the urine, then you know that the kidneys are overworked. And you're going to see a lot of these diuretic drugs, blood pressure-lowering drugs, are excreted through the kidney. And you're going to see a lot of these cases, when you're reading blood labs, eGFR readings go down gradually. Okay? Your first step is to find out, hey, maybe which chemicals are clogging up the kidneys, right? I've seen people not have to do dialysis when their eGFR readings were below 15. We were able to get it up. Some of them would have the little catheter stuck in because they were going in for the home dialysis. And, a month later, the client comes in. I'm like, hey, why do you still have this in you? Oh, my MD says I'm going to need it eventually. I'm like, no. Oh, I may have bought them out earlier. Sorry, right? Okay. On the pharmacology tab, also, I want you to pay attention to the metabolism. So many of you are familiar with the cytochrome P450 enzymes. The metabolism is important to understand. What is a substrate? A substrate is something that enzyme actually acts upon, right? And most enzymes are going to break down the chemical and send it for excretion. Is it an inhibitor? Many drugs inhibit the liver's ability to clear other drugs. That, by definition, is a drug-to-drug interaction. You have one drug that inhibits the liver from breaking down drug 2. Drug 2 gets elevated in the bloodstream, and now you start to see side effects, right? That's the drug-to-drug interaction. There are some drugs that are inducers. We can even think of St. John's wort, cruciferous vegetables, right? When we think about foods rich in indole-3 carbanols, these are inducers. They upregulate the liver's CYP450 enzymes' abilities to clear chemicals. Those are our friends. So these are the most widely studied CYP450 enzymes, right? The 2D6 and the 3A4 are where most medications have been confirmed to be cleared. And we look at this example, diltiazem. When we look at the pharmacology tab, we see that diltiazem, a calcium channel blocker, calcium 2 channel blocker, it's excreted through the liver extensively. However, it's a 3A4 substrate, so the CYP3A4 enzymes are responsible for clearing the drug. However, it's also a 3A4 inhibitor. It's inhibiting its own excretion. So we know that the liver is the liver and the kidneys are major detox organs, and then we have peripheral or secondary organs, right? The lungs, the skin, the lymph. So if the liver is being inhibited, then we expect to see it go through the other routes, okay? Maybe it shows up as a rash, as acne. Maybe it shows up as a cough, or maybe it shows up as body odor, right, coming through the lymph. Maybe it shows up as pain around the lymph nodules all throughout the body. So it is possible that a drug can inhibit its own pathway for excretion. Now, when I looked at Hippocrates.gov and I looked at the side effects, because I have a client I'll show you in a second, he had gynecomastia, right? He had mammary growth, a male. He didn't want to wear a bra, and he was done wearing jackets over his clothing in the heat of summer, right? In California. And so in some side effects you cannot find in Hippocrates.com, so you want to become familiar with PubMed.gov. And PubMed.gov, when I typed in drug-induced gynecomastia, this is what I found. Drugs are a very common cause of gynecomastia and should always be entertained as a possible cause of such a condition. Calcium channel blockers, captopril, digitalis, omeprazole, some antibiotics, growth hormones are all possibly, but less often, the responsible agent, right? So you've got to learn how to use PubMed.gov to find answers to your patient's health issues in addition to using Hippocrates. The two fill in the gaps. Okay. So here's a case example. So we have a lying down blood pressure on top, 103 over 106, and then we have standing, 141, 111, right? So the idea is there's nothing remarkable about the adrenals. We see that rise that we normally want according to the test of orthostatic hypotension, right? So nothing more remarkable about the adrenals, nothing remarkable about the kidneys, because it also rose between the range of 5 to 15, and the pulse didn't increase. Typically, if I see someone, they're lying down, boom, 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 and they stand up, and there's a increase, boom, 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 boom. It means that the heart is now compensating for the adrenals, right? But nothing remarkable in this patient. 5 main complaints. Bowel movements take work. So what's going on with liver, gallbladder, right? Bile obviously lubricates the GI tract. Is there sufficient production? Maybe they had a gallbladder removed. Eczema. The body's trying to detox something, and the liver's insufficient or the kidney's insufficient, and now it's coming through the skin. They sunburn too easily, okay? Deficiency of calcium at the skin, perhaps a deficiency of vitamin F or essential fatty acids. Allergy to dairy, okay? So, I want to check to see if they recently had a DTaP vaccine. Oh, we may have to edit that out. Okay? Gynecomastia, right? So obviously that was his concern. That's, something we want to address. Okay? So we look at his food log. He's got non-fat milk. He's got pizza with cheese. He's got macaroni and cheese and ice cream. Okay, an allergy to dairy. I know you've seen this before, and you've got to help them put 2 and 2 together with food as much as the medications. So what I did was, we'll look at his form. Okay, so he was taking diltiazem for 5 years, swollen lymph glands, so now you know which organ's trying to detox. Vitamin D levels were 31. Obviously, we're going to have to elevate that. Wife had a history of gallstones, and this is important because they have a similar diet, usually. And if she's having some sort of bile stagnation, liver sluggishness, most likely he also has it. Okay? So I look at his form, and I interpret the data directly in the form. Obviously, we put it on the slide. I'll look at the 5 main complaints on the bottom right-hand side. So we saw those, some burns too easily. And then, of course, there's some liver symptoms here, liver-related symptoms, arthritic, brown spots on the skin. Okay, I'll go to this group, and group 5 in the intake form I use is liver gallbladder. Wakens in the middle of the night. Obviously, in Chinese medicine, when we look at the circadian cycle, waking up between 1 to 3 a.m. correlates with some liver insufficiency. Okay, group 5 is liver gallbladder. So lots of detox required for this person, but we have to also address the blood pressure, which is the reason why he's on the diltiazem, and then we have to address supporting the lymph and the skin and the liver and the kidneys just to make sure that the chemical goes out of the body through the normal route. Okay, so this is a protocol that I would start 8 weeks, some liver support, lymph support, calcium, as well as vitamin F, okay, because he sunburns too easily. Get him on a PAGE diet, phase 1, which is really an elimination diet, proteins, vegetables, fats, and obviously avoid dairy elimination, okay? So the opportunity. Now, there's a survey done with 12,000 primary care physicians, found that 66% of them were either less than satisfied or unsatisfied with the practice of medicine. 60% said they would not recommend medicine as a career. Approximately 1/3 of those who participated said they planned to stop seeing patients in the next 1 to 3 years, and another 14% plan to cut back on patient care to part-time. Tying this in with a lack of job satisfaction, MDs also suffer from the highest rate of suicide among professionals. Many others are saddled by drug and alcohol addiction, right? So what this means is there's an opportunity for collaboration. So I have a partnership with 4 MDs. One's a psychiatrist, because there's a lot of people on psychiatric meds, right? The psychotropics are very difficult. I got 2, and the rest are our primary internists, right? Primary care. I have one in Kaiser, which is the local HMO in Northern California, and then I have one is private practice, and the other one takes insurances and also cash pay. How did I build these relationships? Well, what I did was I bought them out. No, I'm just kidding. Okay. What I did was I just knocked on the door, and I said, hey, look, you know what? I noticed you took my client off their blood pressure meds. That's the easiest place to look. Go back to your files and see who was taking off their blood pressure meds. Start there. If you try to see, who can wean the patients, my clients off of SSRIs or antidepressants, That's a tough area to start with because they're programmed to prescribe SSRIs for the patient's lifetime, okay? Start with blood pressure meds. So that's what I did. I went back to my files and I saw, wow, okay, this person took this client off, and I just knocked on the door. And you have to knock on the doors because they're not coming to you. And I say, hey, you want to grab coffee sometime? Grab coffee. And I just say, hey, look, you know what? I'm not paying for this coffee, just so you know, right? That's what I said. No, but I said, hey, look, I've got some clients whose blood pressure is too low now, and I need someone to wean them off. Can I count on you if I send them to you? He said, absolutely. Because the one thing that my friends who are medical doctors and these people I'm building partnerships with is they all got into medical school to help others. When they got out of med school, they kind of transformed, okay? And the industry is responsible for that. But most people became a doctor because they wanted to help. And so one thing I want you to remember is that everyone is doing the best with what they know. Right? Now, you don't have to go in there and talk about how you can help restore function to the organs. You don't have to convert them on, you need to get into acupuncture or chiropractic. You don't need to do any of that. What I want you to remember is that you can be friends with someone who's willing to just go in an area they're not supposed to on occasion, all right? And take them out to lunch, take them out to dinner, and knock on their doors. Look for RNs. Even though RNs don't have the prescription rights, they are friends and they will know which MDs. Look at your holistic medical doctor associations, right, that are local. Look for nurse practitioners. Look for PAs, physician assistants. Look for medical doctors that are holistic. Look to them. They're out there. You've got to find them. Okay? Okay, so this is what I propose as the integrative healthcare model. I believe everyone should have a whole food nutrition practitioner guiding them on what to eat. Yeah, you know, there's some people out there who want to eat McDonald's 5 days a week. But if you can help them get to McDonald's 4 days a week, that's huge, a 20% increase. Then down to 3 days, 2 days, 1 day, and then they start feeling better, and now they believe in food, right? Because everyone knows you are what you eat, but no one really believes it until they find you. Then partner up with a chiropractor, acupuncturist. So my son, you know, he got his first acupuncture at 8 months. He got his first chiropractic treatment at 2 weeks, and he's been on a nutrition protocol before he was even born. My wife had prenatal, you know, optimized fertility, right? This is the model for health and wellness. And then if they're on medications, it's important that you partner up with a medical doctor for medication elimination as necessary when the time is right. I've found also that working with them for at least 6 months helps get them in the mindset that they should be eating food for nutrition and not toxic chemicals for nutrition. It's funny because in Chinese, they say to eat food, the verb, 吃饭, 吃 is the verb to eat. And the verb, when you say take your medicine, it's 吃药. The verb for eating and taking medicine is the same, it's eat, right? Timeless wisdom transferred through the culture. So it's very important that you do have this partnership. Now, of course, do we need medical doctors? Absolutely, you know? Hospitals are important. If I'm in a car accident, my leg is about 20 yards away, you send me to the hospital first, please. Then you send me to the acupuncturist, the chiropractor, and the nutrition practitioner. Very important. We still need them because those are some amazing skills that they can use to save lives. Okay? Emergency medicine is an important field. However, most people need this most of the time. Okay? I propose also that we start to educate people to get into the high-deductible catastrophic care policies. So I pay my acupuncturist, my chiropractor, and my nutritionist. I always get seen by a colleague. I don't try to self-treat. Okay? But I have an insurance policy that covers if I ever need that help. Okay? So, become friends with medical doctors. You can be friends with people of different religions, right? You don't have to convince medical doctors and convert them to your religion, right? You just have to find the openness. And maybe just finding 3 is enough. You don't have to get to the level where you're hugging them, okay? But at least get a couple. Get a couple. And so I wrote the book, The Pharmaceutical Myth, as a complete guide for patients finding their journey to optimal health and wellness. And the first part 1, is the pharmaceutical myth. And it includes 9 questions every person on pharmaceuticals must ask their medical doctors. And really, it's the first 2 that are the most important. And the first one is, do you know how to help people wean off addictive pharmaceuticals? That's the first question. Question number 2 is, do you know if any of my drugs are addictive? Huh? Now, as a former pharmaceutical sales rep, I train medical doctors how to wean their patients off of medications because it was an easy way to get them to switch to the drug I was promoting. There are many medical doctors who don't know how to wean people off medications. So you've got to do your research. And you've got to learn how other people have been successful. Every drug, every client is a different story. There's no one set titration schedule that applies to everybody. The other 7 questions are, how much of this drug is being excreted through my liver? How much of this drug is being excreted through my kidneys? I want to know. I want to know if I'm going to be a candidate for dialysis one day. I just want to know. Can you print out the known side effects of the medications? Right? And so it goes on and on and on. But the 2 most important are, can you help me come off of them? And what's cool is that sometimes when the clients read this book was written for your clients. You'll also benefit from it, but it's mainly for your clients. I have my clients come in and they go up to their medical doctors and they go, I read chapter 6, which is talking about statins, taking me off my statin drug right now. And medical doctors have no choice but to listen. Because you see all those advertisements on television, in magazines. It's only the US and New Zealand that have these direct-to-consumer advertisements. But 80% of the time, a patient asks a medical doctor for a drug. I want the purple pill. They get it 80% of the time. Okay? But what does this mean? We can take that information and we can kind of think about, wow, the pharmaceutical industry is pretty hardcore. Or we can take that information and we can train the patient so when the clients, when they go back and they say, I want to come off of this drug now, we can expect the same to also occur. And I've seen it happen where the MD then concedes, okay? But it's not as high as 80%. It requires a lot of education and then a partnership. So when then this MD calls me up and I say, hey, look, this is what we're trying to achieve. This is what I'm noticing. And then I tell them, hey, when I was a drug rep, this is how I would recommend MDs for this particular drug to guide the patient off. Take it or leave it. You're the prescribing physician. I'm going to leave it on to you, but this is how they would do it. I would, use the process of suggestion. Part 2, so let's say you have clients who are not on any medications, just have them jump to part 2. They can skip part 1, just jump to part 2. It talks about why we got to eat healthy fats, why we got to eat healthy proteins, why we've got to eat fermented foods, why we've got to do detoxes, why they've got to work with a holistic healthcare practitioner. And there are 7 questions where they ask you, are you familiar with the work of Dr. Wesley Price and Dr. Francis Ponder? Questions you already know the answers to. And you can easily say yes, yes, and yes. And then part 3 is a new hope. Questions they need to ask themselves. Who is your holistic healthcare practitioner? Who's your nutritionist? Are you ready to make dietary upgrades? Because at the end of the day, you can do so much, but you have to have them understand that there's work involved, right? And you can turn them to The Pharmaceutical Myth. There's a nice 2.5-minute trailer, very simple. And no more of this trying to lead them to health and being blind to the meds that they're on. We now know, and through the use of Hippocrates, when you're looking at pharmacology and adverse reactions, you have more information now about what some of their health issues could be caused by. So how many of you have seen the movie The Sixth Sense with Bruce Willis? Yeah? Great movie. Okay, I have a lot of friends who are mediums. And at the very end of the movie, the little boy who was used and scared of seeing dead people, what he did was he went and attended this little girl's funeral, and the little girl sought him out, and he went into the room, and he was hidden, and and the little girl threw up, and he was a little scared, but then she said something to him. She said, I need you to help me. And the little boy then went out And this little girl, it was her funeral, right? So he's speaking to the spirit of the girl, and he comes out with this VCR cassette, and he goes to the father. And the father looks at him and says, yeah, and he says, your daughter wanted me to give this to you. And so he took it, popped it into the VCR. He pops it into the VCR, and he sees his daughter fully animated, alive, in bed. And he sees the daughter setting up a camcorder, hides it in the corner, goes back to the bed, sits down, and then he sees the mom, his wife, come in with a tray with her breakfast, and he starts to scoop in a little poison. And then she goes and feeds the daughter. And so this person would be diagnosed with a condition called Munchausen syndrome by proxy, right? It's basically a label for a pattern of behavior in which a caregiver deliberately exaggerates, fabricates, or induces physical, psychological, behavioral, or mental health problems in others. And what this little girl wanted to do was to protect her younger daughter from the same ill fate. And of course, the father was enraged. So when a mother feeds her child a low-dose poison to induce illness, she is diagnosed with Munchausen syndrome by proxy. But when a chemical industry does the same to a society, what is that called? More importantly, what do we do about it, right? We have the tools, and you have the knowledge. And so on the first day back in the office, please update your intake forms to include all information about medication, bioidentical hormones, synthetic supplements, etc. Ask if they're interested in improving their health. So if you want, I will give you my intake form. I have 2 questions on there, and you can take it. I'll give it to you as a Word document. The first question is, are you interested in improving your health to the point where you reduce your medication need? Most people put yes. Some people put no, right? Because they're not ready for it. The second question is, are you interested in improving your health to remove your reliance on any medication whatsoever? Most people put no, some people put yes. What I found is if you work with them nutritionally over 6 months, at least 6 months, most people will change their answers to yes and yes. And that's when I have the conversation about working with the prescribing physician to come off certain medications in the order that I feel is going to be best. So you got to give it at least 6 months. Don't start day 1, right? Okay? Don't call anybody's baby ugly. All right? And then learn how to read and interpret these medications on Hippocrates.com. Learn how to use PubMed.gov as well. And identify 3 potential partners. Like I said, go back to your files. Start looking at societies of holistic allopaths. Start speaking with colleagues to see who they have cross-referral networks with. Maybe even some of you are even working in a medical doctor's office, right, as the nutritionist. Those are our allies, right? I believe that, when I was a kid, I was a teenager, parents, clean up your room, do your homework. And I had this teenage angst. Parents, can't live with them, can't live without them. Well, I take that same mindset today. Medical doctors, can't live with them, but can't live without them, okay? I believe that we should turn me into we, because at the end of the day, that's how we can get people healthy and unmedicated. So thank you for all the amazing work you do. I appreciate the time being here and sharing this information. And for more information about my practice, you can go to thehealingbody.com, and I'll be in the back answering any questions you may have and also signing any books. So thank you for your time and attention.